This is One on One. We're pleased to welcome Dr. Ogori Kalu, who is Director of Breast Surgery at University Hospital and Assistant Professor, Department of Surgical Oncology, Rutgers, New Jersey Medical School. Good to see you, Doctor.
Nice to have you.
Doctor, talk to us about the situation as it relates to young women, particularly in the city of Newark, and breast cancer. There's a serious problem. What is it?
The serious problem with young women and breast cancer in this Newark area is that they're being diagnosed and presenting at much later stages. So we're seeing them at more advanced stages compared to older women who present with breast cancer. I attribute that to the fact that for younger women, we don't have any screening parameters. You know, for older women, we start at age 40 with yearly mammograms. Therefore, we're able to pick up early breast cancers, and because they're picked up at an early stage, their survival is much better. With younger women, we don't have these modalities at their disposal.
So, you know, I know there are a lot of reasons for this, and it's complex, but is one of the reasons, Doctor, that too many young women in the inner city don't think that they are candidates for breast cancer?
Exactly. I think in general, just young people just have this state of feeling invincible. You know, you never think at a young age breast cancer would affect you. I'm seeing women who are as young as 24 who are being diagnosed with breast cancer. And because they don't know what to look out for, they don't know what the problems or symptoms might be, they're presenting much later. And unfortunately for these women, it impacts their overall survival.
So, combating it, talk about it.
Well, I think, in my opinion, the best way to combat it would be just education, educating these young women starting at an early age. You know, part of the elementary school or middle school education is sex education, and part of overall health education for young women and young men. And I think part of that should be educating women on how to do self-breast exams, just simple, basic things.
At what age would you say?
I would say once a young woman has started having her menstrual periods, once she's gone through the developmental changes where her body is changing, she should have an overall education in the differences in her body and the different things that can happen to her body that could be harmful to her, ultimately.
Do you think, knowing Newark the way you do, knowing the community the way you do, that such a conversation about having that kind of education would be well received by most parents, because the children will not have a voice in that?
This is true. It won't be easy, but we do know that when we're treating young people, particularly in the inner cities, they're exposed to a lot of things that maybe other young children may not be. Meaning we're seeing younger women and younger men who are more sexually active at younger ages. And, you know, sometimes we could say that, or at times we can attribute this sexual activity at younger ages based on just not knowing. And curiosity. And once they've reached into that part of their, I guess, sort of growing up and development, they need to be educated on their bodies.
No, I'm not arguing the value. I'm just saying how hard to sell.
Oh, how hard.
And I'm curious as to whether, in fact, there has been a concerted effort with you and your colleagues and others who are involved in the Newark community as it relates to health. And health education to try to have this dialogue?
Mm-hmm. How well it will be received, it's really hard for me to say. You know, I think I'm just coming from the perspective of a clinician.
You know it needs to be done.
Yes, I know it needs to be done.
And if it's not, do we have any reason to believe that these very alarming statistics, and by the way, statistics are nothing more, they're talking about people,
right.
Young women,
right.
that it's going to change?
Right. I think, you know, nationally, when we look at, you know, the data and the information that's made available to us in regards to breast cancer, a majority of breast cancer affects women who are older, postmenopausal. The data suggests that only about 7% of women who are diagnosed with breast cancer nationally fall under the age of 40 or 45.
That's nationally?
That's nationally.
What about in Newark?
However, in my practice, I'm seeing upwards of 15%. 15%
twice the national average
are under 40. puberty between the ages of about 28 to 40 and being diagnosed with breast cancer. I don't know if it's something that's unique to Newark versus or something unique to the inner city or just something that's not really being acknowledged.
So, sorry for
nationwide.
interrupting. Someone says, okay, mammographies sooner. Is it they're not? Are they as effective with younger women?
They're really not, and that just goes to the nature of of a mammography. It's no issue with that. It's just that the mammogram itself is like in simplistic terms an X-ray, and an X-ray is looking for any abnormality, density on imaging to show or identify early cancers. And for younger women who are premenopausal, the younger the woman is, the denser her breast tissue is. So on a mammogram, it's hard to differentiate between what's normal breast tissue versus what is malignancy or tumor in the breast. Therefore, younger women, mammography is not indicated because it's not as effective.
Final question, where's the silver lining here? Bright spot?
I think the bright spot is that, for this show, having me on this show, actually, talking to people and letting people know. I'm going into the communities and I'm talking to young women and even parents and letting them know that, breast cancer is not something that as a mother you should be cognizant of or wary of. You should also try and teach your daughters about breast health and things to look out for. So the brighter side is just making people more aware. And so once you become more aware there's a problem, then the solutions will often follow.
One-on-One with Steve Adubato has been a production of the CAUCUS Educational Corporation, celebrating over 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by New Jersey Resources, the Northward Center, the New Jersey Education Association, Verizon Communications, Investors Bank, New Jersey Sharing Network, and by Choose New Jersey. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.